This is Dr. Candi Overholt with HealthStar Internal Medicine in Newport, Tennessee. I am excited to have you back, and we're going to continue to talk about the disease of diabetes mellitus. Now, remember last time we talked about the difference in type 1 diabetics and type 2 diabetics. Now, what we're going to talk about today is the complications that diabetics can have. Now, basically, you can have microvascular complications or macrovascular complications. So let's talk about what that word means. Micro means small, and vascular is the flow of blood in the blood vessels. And so if you have a small blood vessel disease, you're likely to have blindness, amputation, or kidney failure. And that's exactly what diabetes will do over a long period of time. So microvascular complications cause diabetic neuropathy, where you have numbness and tingling of your feet, and it starts in your toes and it rises up. I have help today. And so the microvascular complications rise in your toes and they come up your legs and they hit your knees, and then they start affecting your hands. Also, kidney failure. Did you know diabetes is the #1 cause of the need for dialysis in the United States? And that's why we check your urine frequently to look and see if you have any protein in your urine, because really, if you think about it, the kidney is like a screen door. And so you have really thick, good screen door. None of the flies from outside will come into your house. Well, the kidney is very similar. That if you have a good, solid, safe kidney, no protein should come out. But if over time you let high blood sugars destroy your kidneys, that screen door will open and open and open, and we'll start detecting protein in your urine. And a blood test is not good enough, because you can lose an entire kidney and still have 100% kidney function. So that's why we check your urine through what's called a microalbumin. Now, the third complication is, again, in the United States, blindness is a major complication of diabetes. And so those are the microvascular complications. And the reason we separate those from the macrovascular complications is because the level of your blood sugar will determine what complications you have over time. Now, we know that that's true with microvascular complications. So every time you drop your A1C by 1 point, you reduce your risk of those 3 complications by 30%. And so remember, just like Hannah told you, our goal is to have your A1C as low as it can be without you having low blood sugars. Now, that changes over time. So when you reach the age 80, then at that point we say, well, those microvascular complications occur over time, and it's actually more harm to keep really low blood sugars, but you still don't want very high blood sugars. So now your A1C goal is less than 8. Now, so that's microvascular complications, and please feel free to comment below if you have more questions about those subjects. But let's talk about macrovascular complications. Now, this is where type 1s and type 2s differ. So your type 2 diabetics, no matter what you do on your blood sugar control, it does not reduce your risk of heart disease and stroke. That's why when you come and you see your doctor, they are asking you to be on an aspirin. They're asking you to be on a cholesterol medication called a statin, because those medications reduce your risk of heart disease and stroke independent of what your blood sugar is. Now, remember, that is not true for a type 1. In the ACCORD trial that was done actually partially where I trained at Wake Forest, we saw that patients with macrovascular complications who were type 1, if they had tight blood sugar control, that they did reduce their macrovascular complications. And so that is a subtle difference between the two. But basically, you want to have tight control of your blood sugar. So if you're waking up in the morning and your fasting blood sugars are consistently over 120, preferably under 100, and you're seeing those higher ones, you need to be concerned that you're not at goal. Or if 2 hours after you eat, your blood sugars are over 180, you may not be at goal. And so talk to your doctor about your A1C. Bless you. Bless you. And be sure that you know what your goals are. And if you're not at goal, it is your responsibility to know your numbers and work alongside your doctor. And if you are not at goal, we'd be happy to help you with your diabetes. So I hope you've learned a little bit about the complications of diabetes. Be sure to like our page. Thank you.